Hi everyone. I wanted to talk to you today about microneedling, as it's one of the more popular treatments that I offer in clinic at TD Aesthetics, and I thought I'd just explain a little bit more about what's involved and why I offer it. So microneedling is a procedure that uses an automated device with lots of tiny little micro needles, or even a manual roller with lots of tiny little micro needles. And the objective is to create little tiny injuries in the skin, in the surface of the skin, to stimulate the skin's own healing process. So the microneedle devices, either the manual roller or the automatic device, have these very fine, super fine needles that repeatedly go in and out of the skin, depending on whether you're rolling it along the surface of the skin or whether you're just using the automatic device to just glide across the surface of the skin. These tiny little punctures, injuries that are created, then stimulate the skin to produce more collagen and elastin as part of its natural healing process, which leads ultimately to smoother, firmer, and more even textured skin. So microneedling can be used anywhere really, on the face, on the neck where you've got those lines or turkey neck, on the chest where you might have slightly droopy skin, even on stretch marks on your stomach and your hips, on your thighs, on the bum, anywhere really where the skin is a little bit slack and lax and needs to be firmed up or tightened up. Microneedling as a procedure is minimally invasive. That means it doesn't require any downtime, so you're not going to have to go and lie down for 2 weeks afterwards. You can pretty much do it and get on with your day. There will be some discomfort because you do have needles going into the skin, albeit very minimally. So there will be some discomfort, but some numbing cream or ice packs can take care of that. Your skin will be red or quite flushed, rather like a bad sunburn, for a few hours or even a couple of days after the procedure, so be prepared for that as well. But that again is temporary and does resolve naturally. The treatment is really effective for conditions like acne, although not active cystic acne where you've got lots and lots of pustular spots, just acne where you've got some breakouts and blemishes. Acne scarring, so from previous acne that you may have had years and years ago and you've been left with the scarring now, microneedling can help the skin to heal and smooth and even out. Even things like rosacea, with or without acne, things like hyperpigmentation where you've got blocks of uneven pigment in the skin, microneedling can help to address that as well. And also things like just general aging signs like lines, wrinkles, stretch marks. Microneedling is great for all of those issues. It's also really good when you combine it with other treatments as part of a course, so a much more holistic approach. So for example, if you use microneedling in combination with chemical peels, the peels help to exfoliate the skin and the microneedling helps to heal the skin and create more collagen and elastin to make it firmer. When you combine it with mesotherapy or with other injectable collagen induction therapies like Sunakos or Profilo, you are stimulating the collagen both from the outside in, from the surface of the skin, and also from the inside out, from underneath the surface of the skin with the injections. So it works well as a combination therapy as well as a standalone therapy. In terms of risks and side effects, the main things are things that I've already mentioned, like the redness, which is quite temporary. You may get some mild bruising, although this is rare, and again, temporary and resolves spontaneously without any further intervention. You may also get some bleeding, but it's very minor, literally pinprick bleeding from where the needles have penetrated the skin. This stops as soon as the treatment stops. So again, it's temporary and resolves without any further issues. You may find that immediately after the treatment and for a couple of days afterwards, your skin feels a little bit dry and might even peel slightly, might get some skin shedding. That's fine, that's part of the healing response and you should just let that happen. But you can also get some hydrating and moisturizing serums to target that dryness and that tight feeling so that your skin continues to be nourished throughout the healing process. You will need more than one session of microneedling to achieve the desired results, because you need to work with your skin's natural cell renewal cycle, which can take anywhere from weeks to months. So a session of 3 or 4 is usually recommended, typically about 4 to 6 weeks apart. The only people who aren't suitable for microneedling would be someone who's pregnant or breastfeeding, because there just aren't enough clinical studies to guarantee the safety of microneedling in those conditions. Someone who has an inflammatory skin condition like eczema or psoriasis, because obviously puncturing the skin rapidly and frequently will just exacerbate and make that inflammation of your skin worse. And someone who's prone to heavy keloid scarring, those raised lumps of scars, not your typical acne scars, but the raised heavy keloid scars. Someone who typically has those scars might not be suitable for microneedling, because obviously that might create more scar tissue, which is something you're trying to avoid. So I hope this has given you a little bit more information about microneedling and whether or not it might be suitable for you. If you want to ask me any more questions about it, or if you've got some more queries that I haven't quite covered in this video, by all means contact me on my social media accounts. That's TD Aesthetics on Facebook, on Instagram, via YouTube, and also via my website at tdaesthetics.com. I look forward to hearing from you. Have a wonderful day. Bye for now.